Welcome back to the Best PT Podcast. This is episode 11, Bariatrics. Beginning with some diagnostic tools. Diagnosis with the BMI over 30 is considered obese. If a person has pear-shaped or gluteofemoral obesity or apple-shaped or abdominal obesity, as well as a waist circumference greater than 40 inches for men or 36 inches for women, or a waist to hip ratio greater than 1.0 for men or 0.85 for women. Stepping back a second, pear-shaped obesity, although a type of obesity has a lower incidence rate of obesity risk factors, while apple-shaped or abdominal obesity has a higher incidence of obesity risk factors. Bariatric interventions. Medical management often involves management of comorbidities such as hypertension or hyperlipidemia, especially if a patient cannot or will not lose weight. Behavioral therapy is useful for understanding goal setting, social support, and motivation. Increased activity with these patients start low and go slow. Diet modifications. A reduction in 500 to 1,000 calories per day will result in 1 to 2 pounds of weight loss per week, and you'll be able to maintain this rate for approximately 6 months. It is completely normal for a patient to slow or plateau with weight loss at 6 months. Pharmacology. Patients may be prescribed appetite suppressors or lipase inhibitors, which prevent the absorption of dietary fat. And finally, community resources. Social and team exercise have always been linked to higher rates of compliance. And a little bit about bariatric surgery. The two most common procedures, the Roux-en-Y gastric bypass and the laparoscopic gastric banding or lap banding. Patients typically have to have a BMI over 40 or over 35 with comorbidities to qualify for these surgeries. That's it for episode 11, talking about bariatrics. Episode 12, we'll talk about nutrition. As always, the outline will be in the show notes. Thanks for